Welcome. Today we have a guest that's going to introduce us to a new solution for patient turning and pressure injury prevention. I am Frank Avalos, your co-host, and I'm with...
Hi, I'm Liz Faust. And Frank, did you know that we're traveling again? Isn't it so exciting? In March, I was in Tampa for NPIAP conference, and I stopped by a booth called Frontier Therapeutics, and I got to talk to them about this amazing product called Toto.
Oh my. When you mentioned that, the first thing I got in my mind is you wearing that little dress with the red slippers saying, I wish I was home.
There's no place like home, right? Yeah, I always try to keep my dog in tow, but no, this was not that Toto. This is such a cool product, and I'm so excited. So today we actually have Kim Levinson. She is the lead inpatient wound ostomy continence nurse for Shepherd Center. It's a 152-bed inpatient rehabilitation hospital. It specializes in spinal cord injury, brain injury, neurological disorders. It's got 10 ICU beds. It's got 2 spinal cord rehab units, 2 brain injury rehab units, and then 1 totally comprehensive rehab unit, which you know this patient population is so challenging. So her work really focuses on the development of a care plan for prevention and treatment of skin breakdown for that patient population, like across the entire institution. And then she works directly with like a wound prevention work group that tracks trends in the pressure injury development of this patients. And she gets to implement interventions to address them. So it's a role that I'm familiar with because it sounds a lot similar to the one that I do. So it is my great pleasure that we're going to discuss this innovative product and how she brought it into her facility. So please help me welcome Miss Kim.
Hi,
Yeah,
guys. Thanks for
Kim.
having me today.
As your role as a WOCN in Shepherd Center, like what problems did you see? And like when you say you were tracking trends with skin breakdown, what were those trends and what were you seeing in that
With our
patient
patient
population?
population, they're extremely high risk for pressure injury breakdown, especially with our patients who are limited mobility or they are freshly injured. They still have a lot of pain issues, a lot of spasticity issues. So turning and positioning in the bed can be very difficult for these patients. It could trigger spasms, so there was a lot of anxiety around turning and positioning with these patients. They're at a higher risk for pressure injuries, both in bed and when they're up in their chairs. So we try to look and see how we can minimize those things. At Shepherd Center, we are very rehab focused. So, of course, we want to emphasize manual turns because manual turns are always best. However, that's not the option with all patients. And so we always want to look at new ways that we can help minimize that pain and anxiety around turning and repositioning in the bed.
Yeah, and Kimberly, I tell you, you're a woman after my own heart because in the early 90s, I used to work at a rehab unit and Shepherd was the place to be. And so the population is unbelievable. But tell me about the trial you did with Toto. Tell me about the patient selection. Tell me how you standardized treatment. What did
So
you
when
find?
the sales rep Dale Wheeler reached out to me, of course he's like, I've got this awesome product for your patients. It's going to kind of really change the way you think about turning. Of course, coming from a sales rep, I'm like, yeah, take that with a grain of salt. But I did allow him to come in and we demoed the product. I was very impressed with it, so we decided to do an in-house trial with it. The main thing we were looking for in our patients was, of course, we didn't want to cause harm. So one of the top priorities was that we wanted to ensure that the patients that we approved for the trial program did not have any current pressure injuries. So that was one of the main barriers to becoming one of the patients on the trial was that they could not have pressure injuries. We also wanted to look at people who had pain with turns. So if they had multiple rib fractures bilaterally, or if it triggered a whole body spasm every time they were being turned and repositioned, those are the types of patients we wanted to trial this on. A lot of people who complained about sleep disruption we thought might be appropriate for this type of product. So those were the main things we were looking at, that they didn't have pressure injuries already, that they were having some type of pain related to turns and positioning, or they were having sleep disruption with their turns and positioning at night.
What is this Toto device? I mean, there's a picture of it up on our screen now, but can you describe what the device is and kind of how it works for your patient population? Sounds like initially you were trialing it for prevention.
Correct. So with the Toto device, it's actually an inflatable platform that goes on the bed frame underneath the mattress, and one side will completely inflate and lift both the mattress and the patient to a full 30-degree angle, and you can set it for intervals between 30 minutes, 1 hour, 2 hours, 3 hours, and 4 hours. The automatic setting is usually 2 hours, so it would inflate, do the 30-degree turn, keep that patient in position for 2 hours, deflate, inflate on the other side, so you get a full 30-degree turn on the opposite side, and then deflate, allow them to lay supine for the 2 hours. So you get supine and a left and a right turn for 2 hours essentially, without having to physically go in and turn the patient.
I'm sure your staff love that.
The staff love it.
I would like that
Very
too.
skeptical because, like I said, we are very hands-on. Manual is best. Prone is always the best option, of course, for pressure offloading, but of course that's not an option for all patients. So we wanted to look at things that were going to give us options and interventions for patients. But actually, my staff was very skeptical. They're like, I don't feel like they're actually getting a 30-degree turn. I would rather go in and manually turn the patient. So it took a lot of buy-in for my staff to truly understand that the patients were receiving a full 30-degree offload.
Yeah, and Kimberly, I'm telling you, I did some research on this before the show because I was intrigued, because Liz and I are no strangers to the pressure injury prevention programs, but I was amazed at the weight capacity that this product can handle. And it said, Liz, 551. You and I can get in the same bed and still be turned with no problem.
Don't try that. Don't try that.
So, no.
Not happening. The answer's no.
And the last thing I want to tell for those of you listening, this product actually has been around in the UK, and there's a lot of literature coming from the UK. So it's if you have time, read some of that work.
Yeah, and I'm sharing an image right now that's from one of the videos that's on YouTube from Frontier, and it's showing the pressure mapping, because in my mind, when we look at the MPIAP or the UAP guidelines, it tells us, 30-degree turns every 2 hours while in bed is the gold standard. But it doesn't really say manual turn, but how else would you know, right? Like, how else would you do that? And I mean, I didn't even know this innovative technology existed, but to show from a pressure mapping standpoint that you are truly offloading the patient, I think is really that gold standard. So Kim, can you share from your trial when you focused on this for prevention, what did you see in your patients when the trial was completed?
So once we completed the trial, we did surveys with both the nursing staff and the patients. The main thing we found that impressed us to the point that we ended up purchasing some of the products was no new pressure injuries were created. And that was very impressive, especially in this high-risk population. And also the feedback was on those exit interviews was they actually had better sleep. There was less anxiety about turning and repositioning. There was decreased need for their PRN sleep medications. And they felt like they were able to be more engaged in their rehab day because they got a full night's sleep instead of that constant every 2 to 3 hour sleep disruption of turning and repositioning at night. So we were impressed to the point that we ended up that first year, once the trial was completed, we bought 10 units to use house-wide.
And now that you have the product, tell me, how has your practice changed since Toto's in the building?
Since our practices changed with COVID, it really impacted and solidified the need for this device. We did have a few COVID positive patients that we had to keep in isolation. And of course, you want to minimize the amount of staff that are in the room. So we automatically placed all the COVID positive patients on the Toto turning device. And it helped an insurmountable amount of labor for the nurse to be at the bedside. She could turn it on, go in at the scheduled times to ensure that the turn had occurred. So the nurses have to visualize that the turn has occurred, that the patient's heels are still floated, that they're still safe in the bed, that they still have access to their call light. But that physical part of turning and repositioning someone was completely eliminated. And none of those patients, even COVID positive with everything they had going on medically, did not develop pressure injuries at that time. So we were extremely impressed. And now all the nurses are calling me like, I think this patient could possibly be a good candidate for Toto. So instead of me having to ask the nurse, please make sure you're utilizing this product, it's now, I'm sorry, they're all in use. We can't accommodate you right now.
Yeah, no, you're getting me excited. I want to try this at our facility now.
So we fill out a projects like calculator for all of our like capital budget items. And with the cost of a stage 3 or 4 pressure injury being over $43,000, I would think one prevention would cover your costs year over year. I mean, I think this is, worth its weight in gold, I'm sure.
Yeah, and Liz, as a physical therapist, I'm thinking staff injury. You're minimizing staff injury. You know how many times you go in the room and nobody's around there to help you turn somebody? So,
Yeah, it was working so well that we actually kind of loosened up our parameters once the trial was completed, and we actually placed patients with pressure injuries on it. So we combined our low profile, low air loss mattresses, a group 2 air mattress with the Toto underneath. And because our length of stays are like 52, 53 days, we actually had patients that went on to heal stage 3 pressure injuries on it.
Oh, that's awesome. Oh, so it's not just for prevention, it's for treatment as well.
Correct. We were very wary when we first started the trial, so we only looked at it from a prevention only standpoint. But as we got more comfortable with the device, we did expand our parameters, and we do place patients with pressure injuries that just cannot tolerate turns, and it may be due to pain, it may be due to brain injuries, and they're just not able to comprehend why they need to be turned and repositioned. Um, but it allows us to at least allow for some offloading of that pressure injury where they may have not gotten any. And so we thought it was well worth the benefit, and we were very, very impressed with the outcomes.
that's
Well,
great.
thank you so much, Kim. I think Frank and I are going to be headed to Fort Worth, Texas in June to go to WOCN next, and Frontier Therapeutics will be at booth 218. So if anybody stops by the booth, they might see Frank and I demoing the Toto unit. You never know.
But we're not going to reach the weight limit, let's just say.
No, we won't. 551. I mean, that's significant right there. I totally agree. So, thank you so much, Kim, for joining us on our show today and sharing your experience with the Toto device. I know Frank and I are both super excited to hear this, and we're both kind of running back to our institutions to be like, why don't we have this? And I think COVID probably slowed down how widespread this really should have been. But I'm just thinking about what if we would have had this during COVID? What would our rates have looked like then? So this is great, and I thank you so much for joining us. And by the way, it's Nurses Week, Nurses Appreciation Week. Happy Nurses Week.
Nurse
Thank you
Week.
for having me.
Yes.
So, and make sure you like us and follow us. We're on Facebook and our YouTube channel.
We also want you to like all of the APWCA's social media through LinkedIn, Facebook, Instagram, and Twitter. Thank you so much for watching.